Patients will come to us to see us for issues mainly dealing with sleep disordered breathing, things like obstructive sleep apnea, central sleep apnea, hypoventilation. They'll also come to see us for other disorders, things like insomnia, narcolepsy, anything relating to sleep and issues during sleep, whether it's respiratory breathing related or any kind of issues they may have with their brain as far as sleep goes. My name is Jonathan, and this is my life as a sleep technologist. My father was actually in sleep, and he had been in sleep for a while, and the company that he worked for was looking for a position, or a sleep technologist. I got on-the-job training through them, and that's how I actually got started. You could go through a process called the A-Step, which consisted of various modules, and then you had to have 18 months of clinical experience before you could sit and take your registry exam. They do offer associate's degree programs very similar to X-ray or ultrasound that are very similar in that they provide the education and then an opportunity to take the exam afterwards. The A-Step program that I took was actually something I took online. Yeah, it was a series of modules, basically online courses and various things sleep related. After a number of years working where I was and getting my certification, my license, my registry, I decided to move here because of the opportunities they provided here. It's a sleep study, so it is run overnight. When I come in, I check my patient paperwork just to see the name of the patient type, so I can get my supplies prepared depending on if there's any therapeutic interventions that I need to perform, that sort of thing. So I'll go over all of my paperwork, I'll get all of my equipment set up, and then we do our evening huddle, which is all the technologists and the physicians make a conference call, and that way we can describe our patient, our type of study, any therapies involved, any questions we may have, so that they get answered and all the study types are updated to the most appropriate. Then after that, do patient intake, which consists of getting the patient, doing a sleep history questionnaire, just questions about how they sleep at home regularly, height and weight, that kind of thing. And then after that, we have the setup process, which includes applying all of the electrodes. We do nearly a full 1020 EEG setup, and we also apply EKG electrodes for the heart, respiratory belts, EMG muscle electrodes for the legs, and then a nasal cannula to measure air pressure and a thermistor to measure airflow. And then after that, we do our monitoring, which consists of at least 8 hours of recording time, which during that period, it will either be doing a diagnostic, which is basically just an observation study, or we'll do therapies such as CPAP, BiPAP, oxygen titrations, that sort of thing. Then in the morning, disconnect the patient, do all of my paperwork, which includes summaries, worksheets, basically detailing what happened over the course of the night. And then we'll do the morning huddle, which we discuss any equipment issues we may have had or any medical issues we may have had throughout the night. Then I go home. Here at Texas Children's, it's about 13 hours. Like I said, I get here about 6. I'll leave about 7:15 in the morning. When I'm off, it's real nice. I get to spend more time with children. I get to pursue any other education I may be. You can work another job if that is what you want to do. There's plenty of opportunities to do other things when your work time is so consolidated into those 3 days. Best parts of the career that I have right now is definitely the patient interaction, patient care. I love dealing with children specifically, but I like dealing with people in general. You got to be able to, you got to really enjoy talking to people and meeting people and being able to work with them within some of their disabilities. That's a key part of really any medical field, but sleep specifically, because a lot of times when they come in and their sleep is not right, it affects them during the day. So they can be irritable and sleepy all the time and things like that. So it's just being very compassionate and understanding in regards to patients. Definitely beef up your communication skills because it'll help you out. I'm a night tech, but they do have a night supervisor position. They also have directors of the sleep lab, sleep program managers, that kind of thing. And those are all people who have been in sleep and may have also other degrees, things like business management, healthcare information management, that kind of thing. There are also lateral moves you can make if, over time you've been working nights for a while and you want a daytime position. They do have daytime technologists, which basically prepare the study data for the physicians to do their interpretations, and they're also the liaison between the physicians and sometimes the patients and hospital staff. This field has allowed me to provide for my children, my wife. We have a house, cars. We like to take trips throughout the year, things like that. So it definitely has allowed me to provide a stable situation for my children to grow up in and to reduce the stress on the family. When patients present with sleep disordered breathing, it has a huge impact on their day-to-day lives by alleviating their obstructive sleep apnea through the use of CPAP or BiPAP. It will help with their other issues throughout the day. It can change somebody's life. What are you up for?